Welcome to This Explainer. If you've ever, winced just bending down to pick up a dropped pen, or maybe felt that sudden sharp twinge radiating down your leg, well, you are absolutely not alone. Today, we're going to validate your experiences with back pain and dive straight into the rigorous medical evidence. We want to see what actually helps and what's just a medical myth. Here's our roadmap for today. 1. The anatomy of pain. 2. Risks and red flags. 3. Diagnosing the problem. 4. The psychology of pain. And 5. Treatments that actually work. Let's get right into it.
Section 1. The anatomy of pain. Understanding the physical reality. So, a super common culprit behind all that agony is a herniated disc. Basically, this is a problem with one of those rubbery cushions, the discs, that sit between the stacked bones or vertebrae of your spine. Most of the time, these occur in the lower back, and man, they can cause some sharp burning pain, weakness, or even radiating numbness shooting right down your leg.
A great way to think of a spinal disc is kind of like a jelly donut. You've got the nucleus, that's the soft jelly-like center, and the annulus, which is the tougher, rubbery exterior. A herniation actually happens when that soft jelly pushes out through a tear or a crack in the tough exterior. Now, sometimes people have a herniated disc without any symptoms at all. But when that pushed-out jelly compresses a nerve, yeah, that is exactly when you feel that intense, sharp pain.
Moving on to Section 2. Risks and red flags. Who is at risk and when to worry?
The Mayo Clinic identifies a few key risk factors for herniated discs. We've got excess body weight, which obviously puts extra stress on your lower back. Then there's having a physically demanding occupation, genetics, frequent driving, because that engine vibration actually puts pressure on your spine, and of course being completely sedentary. But here is a genuinely surprising connection: smoking. It's thought that smoking actually lessens the oxygen supply to your spinal discs, causing them to break down and degenerate much faster. It's a pretty fascinating connection between your lungs and your spinal health, right?
Now, while a lot of back pain cases do improve over time without surgery, you absolutely must seek emergency medical attention if you experience these severe red flags. If your symptoms worsen to the point that they hamper your daily activities, or if bladder or bowel dysfunction occurs, meaning incontinence or trouble urinating even when you have a full bladder, you need help immediately. The same goes for saddle anesthesia. That's a progressive loss of sensation in the areas that would, touch a saddle, like your inner thighs and rectum. This indicates compression of the cauda equina nerves at the base of your spinal cord. That is a serious medical emergency that could literally lead to permanent weakness.
Section 3. Diagnosing the problem, the surprising truth about imaging. Okay, so what do you actually do when your back starts to hurt? To separate medical myth from reality here, we're relying on the definitive clinical guidelines from the North American Spine Society. This is a massive, rigorous review of over 45,000 articles, specifically on the diagnosis and treatment of low back pain. The absolutely crucial takeaway is right here in this quote. There is insufficient evidence to make a recommendation for or against obtaining imaging in the absence of red flags. Demanding an immediate X-ray or MRI is such a common reaction, right? But unless you have those specific red flags we literally just discussed, early imaging rarely changes your initial treatment plan. So skipping that unnecessary MRI right off the bat, it can actually save you time, money, and a whole lot of unnecessary anxiety.
Section 4. The psychology of pain. The mind-body connection.
The NASS guidelines explicitly highlight something called kinesiophobia. That's a fear of movement. When your back hurts, your natural human instinct is to just freeze, right? To protect it and avoid moving at all costs. But the clinical evidence proves this fear is a negative prognostic factor, meaning if you are terrified to move, it actively hinders your physical recovery and predicts a significantly worse response to your overall treatment.
Because of this profound mind-body connection, treatments targeting fear avoidance combined with physical therapy earn a grade A recommendation to improve low back pain in the first 6 months. In the NASS system, that is their highest possible recommendation, backed by consistent level 1 evidence. So combining cognitive behavioral therapy with physical therapy isn't just some nice little bonus. It is a top-tier, evidence-based pathway to get you moving again, reduce your pain levels, and get you back to your life. Section 5. Treatments that actually work. The Evidence Scorecard.
All right, this scorecard might completely contradict what you've been told in the past. Topical Capsicum, which is a cream derived from chili peppers, actually gets a grade A recommendation for short-term relief. Standard non-selective NSAIDs and opioids, they only get a grade B with strict limits on duration. But the real surprise here is at the bottom. Antidepressants and traction both get grade A recommendations to definitively avoid them for this specific type of pain.
Furthermore, while back at school, cognitive behavioral therapy and applying heat for acute pain are solidly supported by evidence, some absolute clinic favorites actually fall short. Popular treatments like lidocaine patches, ultrasound for functional outcomes, and TENS units for short-term relief, they show insufficient or conflicting clinical evidence that they provide real functional improvement. Crazy, right? So, armed with the anatomical reality of that jelly donut disc and a definitive medical scorecard, you are now empowered to make smarter choices. Will you focus on overcoming the fear of movement or skip the lidocaine patch for chili pepper cream? The next time your back aches, are you going to treat the actual problem or just a medical myth? Thanks for joining me on this explainer, and keep questioning the evidence.